for the audience to join us. Thank you. So hi everyone who's just joined. We're just waiting a couple of seconds for all our audience to join us. Thank you. Okay, so hi everyone, honorable speakers, webinar attendees, friends, a very warm welcome. I'm Putunati and I'm honored to moderate this webinar organized as a collaborative effort between the Oxford Poverty and Human Development Initiative, OPHI, at the University of Oxford and the Faculty of Economics and Business, Universitas Indonesia. This webinar aims to explore and highlight the importance of thinking of poverty and measuring poverty within a multidimensional framework. This framework has become even more important in a world riddled with the effects of COVID-19. Before we start, may I please request that questions from our audience be directed to the chat box on your screens? We will have a Q&A session to address these questions at the end of the panel session. Thank you so much. We now open this webinar and I am honored to turn to Professor Ari Kunchoro, Rector of the University of Indonesia, to deliver the opening address. Professor Kunchoro, the screen is yours.
Very good afternoon, distinguished speakers, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. On behalf of Universitas Indonesia, it is a great pleasure to welcome all of you to a collaborative virtual seminar in the topic of multidimensional poverty in Indonesia during the COVID-19 pandemic. This webinar is organized by the Oxford Poverty and Human Development Initiative, University of Oxford, and Faculty of Economics and Business, Universitas Indonesia. I would also like to express our sincere gratitude and appreciation to our keynote speaker, Professor Sabina Al-Khair from Oxford Poverty and Human Development Initiative, University of Oxford, and our panelist, Dr. Vivi Yulaswati from Ministry of National Development Planning, Dr. Khatib Basri and Dr. Teguh Darsato from Universitas Indonesia for their tremendous contribution and support to this event. This online event will discuss the impact of the pandemic on multidimensional poverty in Indonesia and how measurement may inform and guide robust policy to alleviate COVID-19 effects on Indonesia's most vulnerable. The pandemic of COVID-19 is a health shock that has changed our life and all human activity. The COVID-19 has disrupted the Indonesian economy. The economic growth has decreased by minus 5.32% in second quarter 2020 and minus 3.49% in the third quarter 2020. Moreover, around 2.67 million workers are being unemployed and around 5.4 million people are becoming dropout from National Health Insurance JKN program, and around 1.6 people has fallen into poverty in the early COVID-19. This condition has made some part of society becoming more vulnerable in the time of COVID-19. The Oxford Poverty of Human Development Initiative reported that Indonesia is one of 10 countries most vulnerable to COVID-19. As the COVID-19 has deprived all aspects of society, I noted that the importance to consider the multifaceted deprivation aspect of life in measuring poverty and welfare, because a single measurement such as monetary measurement might not fully capture the human aspect of deprivation. The multidimensional poverty measurement will provide accurate and robust information to build rapid assessment of vulnerability and to support governments in understanding of what might be best be done, particularly in the midst of COVID-19. Finally, I hope that this event is the beginning of the collaboration between OPHI, University of Oxford, and Faculty of Economic and Business University of Indonesia. There will be many more collaboration in the future. Even though this seminar is held virtually, I hope this event will still provide various insights in the field of development, poverty, and policy to protect the most vulnerable part of society in Indonesia. May you have a wonderful experience in sharing your knowledge. Enjoy the webinar.
Thank you very much, Professor Kunchoro. Yes, it is very important to recognize the multifaceted nature of poverty and that to truly address deprivation within all dimensions, more evidence-based policies are needed. Collaboration and working together between research institutions is also a key way to discover effective strategies to emerge strong from the pandemic, which is truly a global challenge that every nation is facing. Now we turn to Professor Sabina Al-Khair, Director of the Oxford Poverty and Human Development Initiative, OPHI, at Oxford University for an in-depth overview of the Multidimensional Poverty Index and how it may help governments bring together important indicators of poverty as a structure that can be looked at together, particularly to address the effects of the pandemic. Professor Al-Khair, the screen is yours.
Thank you so much, Putu. Thank you so much, colleagues. And I do very much echo Professor's hope that this is the first and not the last engagement with university colleagues, with students, with colleagues in government and other institutions. We are a long-time admirer of your work and your leadership in statistics and in so many other areas. What I'm going to do in 10 to 15 minutes is present some of the findings of the global MPI, Multidimensional Poverty Index, which include findings for Indonesia using the most recent global demographic and health survey 2017, and then have some closing reflections on the need perhaps for a better measure for Indonesia, one which uses national data sources and more appropriate definitions, and also on how this is used during COVID. The Global Multidimensional Poverty Index, or MPI, was developed with OPHI and UNDP in the year 2010 and is updated annually. And it's a simple measure in which you identify 10 indicators and a person's own achievements with respect to each of the 10 indicators. Is anybody in your household undernourished? Has a child died in the last 5 years? Has nobody in your household completed 6 years of schooling? Is a child not attending school through class 8? Do you lack clean cooking fuel, adequate sanitation, safe drinking water, electricity access, good quality housing materials? And do you own more than one of a set of small assets like radio, television, telephone, bicycle, motorcycle, animal cart, computer, refrigerator? And if you own a car or truck, you're not deprived in assets. And anybody who is deprived in 1/3 of these weighted indicators, where they are weighted equally across the 3 dimensions of health, education, and living standards, is identified as poor. And so we can say what percentage of people are poor because they're deprived in 1/3 or more of the weighted indicators. And we can also say how intense is poverty, in what percentage of deprivations on average are poor people experiencing deprivations in these indices. This year, the global MPI covers 107 countries and 5.9 billion people. And we have new estimates for 25 countries, including Indonesia. Across those 5.9 billion people, 1.3 billion, or 22%, are poor, deprived in 1/3 or more of those indicators. And half of these people are children under the age of 18. 2/3 don't live in low-income countries, but they live in middle-income countries. The vast majority in rural areas and in South Asia and Sub-Saharan Africa. But when we say multidimensional, we mean multidimensional. 99% of the poor are deprived in at least 3 of those 10 indicators, and over 83% in 5 or more. So this multidimensional poverty measure stands as a sister to $1.90 a day or other monetary measures because it captures the overlapping deprivations that, as Amartya Sen said, batter and diminish a poor person's life at the same time. And it also changes because if you reduce any deprivation of any poor person, the MPI goes down. If you put a child in school, if you improve sanitation, you do not have to wait until these affect monetary poverty, but that year you see change. So what did we find for Indonesia? We found that in 2017, 3.6% of people were poor, were deprived in 1/3 or more of those indicators. A little bit higher in the rural areas, 5.3%, than in the urban areas. We also found that if you extend it and say who's deprived in 20% to 33%, who is vulnerable to poverty, it's 4.7% of the population. And that's actually relatively low. For example, in China, 2014, 3.9% of people were MPI poor, but 17.4% of people were vulnerable. And again, in Sri Lanka, lower poverty, but higher vulnerability. So I'd like to first of all admit that the global MPI is not the right measure of poverty for Indonesia. It's too low, it's too acute, and Indonesia is much more sophisticated. But I thought it might be interesting for you to see how you are seen internationally, because these comparisons could be interesting. So first of all, we break the global MPI down by over 1,200 regions, and poverty internationally ranges from 0 to 99%. Within Indonesia, there is a range from Riau or Jakarta or Jambi, which have poverty rates of less than 1.5%, to Papua or East Nusa Tenggara, in which poverty is 16 to 18% of the population. So there's definitely a distribution worth considering across the subnational regions of Indonesia. This graphic shows the regions ranked from least poor on the left, the poorest on the right. And it shows the composition of poverty across different indicators. And a very interesting aspect of the poor in Indonesia is, I mentioned intensity, and we saw that overall intensity in Indonesia is 38.7%. That's the average percentage of the indicators that poor people are deprived in. And a positive feature for poverty reduction is that over 3/4 of the poor people, and it's less than 10, it's 9.5 million people are poor in 2017, are deprived in less than 40% of the indicators. So it is relatively easy to, in a sense, end their poverty. But what are the trends? And that's what I thought you would be most interested in. This year, we released trends with UNDP for 75 countries, and 5 billion people. And the fastest in absolute terms are going to be the countries with high levels of poverty. Because if poverty is low in absolute terms, you will not be able to have a fast reduction. You don't have enough poverty. But in relative terms, you can make visible. And across 75 countries, Indonesia was the 5th fastest in relative terms to reduce poverty, after North Macedonia, China, Armenia, and Kazakhstan. And in terms of the number of poor leaving poverty, in Indonesia, 8 million people left poverty in 5 years. So just to look into that a little bit more, in 2012, nearly 7% of people were poor, and by 2017, it was 3.6%. If you look at the MPI, in terms of point estimates, it was cut by half. When you consider standard errors, it was not. And we are not quite sure, so we don't announce that. But it's worth noticing because the SDG goal is to cut multidimensional poverty, target 1.2 out of the 169 targets. The second one is to cut multidimensional poverty by half. And in terms of the global MPI, Indonesia clearly will have done that far within 15 years, in just over 5 years. In fact, 17 of the 33 subnational regions did cut MPI by 1/2, considering standard errors. The headcount ratio never reduces as fast because MPI captures reductions among the poorest. That doesn't yet mean a person leaves poverty. And all 9 of the indicators, Indonesia does not have nutrition, reduced multidimensional poverty statistically significantly. And as I said, in relative terms, Indonesia was the 5th fastest of all the countries covered, reducing MPI by over 13% in relative terms per year, and income poverty by 12.2%. Headcount ratio by 12.2% per year. Another positive feature of the reduction in Indonesia comes when we consider the goal of leaving no one behind. What we want is we want the poorest groups to make reduction the fastest. So in this slide, the regions are ranked from the least poor on the left to the poorest on the right. The size of the bubble is the number of poor people in 2012, and the depth is the speed of reduction, and the fastest are near the bottom. And so what you see is that very nearly it's a strong pro-poorist tendency. So Papua, East Nusa Tenggara, they had fast reductions of MPI, and so they are not being left behind. They are indeed catching up because their absolute reduction has been faster. This pattern continues if we look across age groups, where persons aged 60 plus are the poorest and produce reduced poverty the fastest, followed by the next poorest group, children under 10, and then children 10 to 17. And there were also positive reductions in both rural and urban areas, with a stronger reduction in rural areas. So again, a pro-poorest or poorer tendency. So this is a positive finding which we don't find in all countries, that the equitable nature of the poverty reduction is a positive feature. And although we celebrate this fact, we must recognize that when we compare India's reduction in the headcount ratio of MPI to the reduction in the headcount ratio of $1.90 a day in the same period, the reduction is not as fast as the monetary poverty reduction. And yet, in comparison with other countries, as we've seen, it's very strong. So I'd like to close this by a couple words on looking forward on the COVID and on national poverty measures. So in terms of looking forward, we identified which of the countries would be on track to cut their MPI by half from 2015 to 2030. And we found that 47 of the 75 countries were on track. 10, it was ambiguous. It depended what model of projection we used. And for 18, they were off track by all models. And then we implemented some simulations, micro simulations at the household level, using data from WFP and UNESCO to predict increases in undernutrition and in children out of school. And we found, sadly, that as we've already heard, many countries are hit not just by the pandemic, but by the economic cost of the recession, the loss of growth, the loss of jobs, and of fiscal space. And so multidimensional poverty trends seem set to go back from 3 to 10 years. But again, that is not a dictation, that is a possibility. And our aim in announcing those figures is to say that with policy efforts, those trends could indeed not occur. And our hope very much is to support countries in using leadership to take the space and the fiscal resources that they do have and reduce poverty during the pandemic. We are privileged to be the secretariat of a South-South network now with 60 countries, and Indonesia has and is a participant in that network. in a General Assembly event at which your minister, among other leaders, spoke, many expressed the need, but also the possibility that leaders could really turn a corner, as Sania Nishtar said from Pakistan, have an inflection point during COVID. We recognize in the words of Ashraf Ghani, His Excellency the President of Afghanistan, that COVID is a hyper event. It affects so many different aspects, including poverty, but that there is a possibility to actually use the resources, the energy, and the space for creativity that COVID has also opened to direct resources at making a historic change in ending poverty. And so I would simply want to close with some reflections on Indonesia. First of all, as I said at the start, the global MPI measures acute poverty. And as such, it is not a useful tool for the government of Indonesia. Many other countries in that situation, Armenia, Maldives, Palestine, Philippines, Sri Lanka, Seychelles, Thailand, Vietnam, they also have very low values of the global MPI. So in those countries, they have developed different definitions of poverty that carry the priorities and the aspirations both of the government and of the poor persons and communities. And they use these as official national statistics of poverty that complement their monetary poverty statistics, but are used to guide policies. And so a couple uses, they report them as indicator 1.2.2 in the SDGs, but they use them for budgeting, for targeting, policy design. But very much we are working and have been working overtime since March in using the measures for COVID response, identifying the near poor, the new poor, those in difficult circumstances of comorbidities, to target resources to them. And we can share many lessons from countries in the network about that, as well as for supporting coordination across sectors and across levels of government. There's a recognition in the statistics community of Indonesia's leadership, which is unchallenged across many, many countries, but also of its policy commitments to these and related issues. So it would be an honor for us to learn from you and to hear your reflections on these and related topics. Thank you so, so much for this exchange.
Thank you very much, Professor Alkaya, for the very insightful overview, particularly in the midst of this pandemic and global recession. The MPI and national MPI is and can become a fundamental tool to improve and extend the reach of policies to the poor and most vulnerable. We now turn to Dr. Teguh Dartanto, Vice Dean of the Faculty of Economics and Business, University of Indonesia, to give us an overview of what's going on in Indonesia. Dr. Dartanto, the screen is yours.
Okay, thank you very much, Nikki, for the time, and thank you very much for Professor Alkhair for providing the insight about the issues on the multidimensional poverty index. Today, I would like to share two things today. And the first is about the COVID-19 and the issues on adverse effect to the economic, unemployment, health, and education. And the second part, I would like to share about our update on the national multidimensional poverty index. That may be a little bit different with the Professor Alkhair presentation about the dimension and also indicator. So we also try to conduct on the micro simulation to assess the impact of COVID-19 on MPI in Indonesia. Maybe this is just a refresh for us, all of the fellow from Indonesia or outside Indonesia, that Indonesia still struggle to COVID-19, and we never know when the first wave will reach the peaks, because the condition is still increasing. We are still in the first wave, and the government's strategy is released on the public health measure and also the expectation on the vaccine COVID-19 in the next years. And there is a possibility in the government to take a handbrake if the case is uncontrolled. This is the condition in Indonesia. And the second thing is the COVID is look like the iceberg in Indonesia. I just show about the little fact in Indonesia that the real case of the COVID have to be higher than the reported positive cases, because the government is only adopting narrow testing strategy. This means that the only person with the symptom will be tested, free testing in the public health service facility. This is just the case of Jakarta that we would like to show that the number of the confirmed COVID-19 death for Jakarta in the September 2020 was only a quarter of the number of the suspected cases. This is just showing that the gray one is the death with the confirmed COVID-19, but the blue one is the death burial with the COVID-19 protocol. So it's mean that the real condition of the COVID is the higher than the reported case. What is the implication on this? And then this is like the macroeconomic overview, the COVID economic and employment. And then this is, I think, the first time of Indonesia and they experience the recession after the Asian financial crisis. Because in the second quarter, as mentioned, Prof. Ari Kunchoro, the rector, and that our economic growth in the quarter 2 and quarter 3 is negative. The second quarter is minus 5.3%, and the third quarter is minus 3.5%. This condition will affected the worker, around 29 million worker affected, and 2.6 million being unemployed, and also 24 million people they experience to reduce working hours. So looks like they are underemployed, or the 1.8 million is temporarily not working. This is the condition, the fact in Indonesia that the unemployment becoming increased a lot, is almost 2 percentage point. What happened in the this is just I just give a little bit example about the social health insurance. There are many people drop out because of unemployment, and they cannot pay the premium, and there is like the 5.4 million people drop out from the system. Means that they cannot access the healthcare facilities during the pandemic. So this may be in the long term will increase the risk of people become dead, not coming from the COVID, but because they don't get the proper healthcare services. This is in the term of the health. What happened in the term of the education? This is just I would like to show you about this is the latest data in the March 2020. This is the access of internet access by education level. So the 1 is the poorest and the 10 is the richest. Look at the condition of the primary school student. So only 1 out of 5 the primary school student from the poorest family don't have access internet. So if they don't have access internet, and then the pandemic forced them to do online distant learning, so some of them they cannot follow the education, they cannot access the education. Some of them maybe just play, or maybe will increase the number of the dropout. So maybe in the future or the long term will impact on the years of schooling. So looking at this condition, we're trying to accommodate to make the simulation what happened in our national multidimensional poverty index. So the poverty trends in Indonesia using the monetary single measurement. The headcount index is already increased 0.56 percentage point, or equivalent to 1.6 million people. This is in the yearly of COVID-19, in the data from the September to March 2020, that this is just beginning of the pandemic. But we have to note that the single monetary measurement is cannot fully capture human deprivation during the COVID-19, because there is many problem on the health issue, on the education, on the human dignity, and also the standard of living. So, for example, if those who don't have access, for example, safe drinking water or maybe bad sanitation, they are have the high risk to exposure to the COVID-19. So the poverty must be seen as the deprivation of the basic capabilities rather than the low of incomes. So we are using the national multidimensional poverty index that this is like we developed in collaboration between our institute, Institute for Economic and Social Research, at that time with the UNDP Indonesia, trying to develop the national multidimensional poverty index. That little bit difference with the global MPI, but we still use the same dimension, health, education, and standard of living, but we little bit difference in the indicator, but not fully difference, but most likely we already adopt the global MPI. But we use the health, education, standard of living, and also the employment, because I think this is very important, because the employment is part of the human dignity. And then we use the indicator like the unemployment, informal job, and working hours. And in education, we also use the indicator school attendance, years of schooling, and adult illiteracy. And health, we use the indicator birth attendance by health professional, vaccination. This is one of the important thing for the COVID-19, because all people expected for vaccination next years, and have insurance ownership. Yeah, this should be add, for example, nutrition. If we because in SOSNAS data, National Socioeconomic Survey data is not fully good for nutrition information, but we're trying to accommodate this. That this is already we done maybe a couple of years ago, and then we're trying to update every years. So as I mentioned by Professor Alkir, that this is the simple thing, how to make the illustration. For example, this is we use only two dimension and also 5 indicator, A1, A2, B1, B2, and then every dimension has this equal contribution and the half. And for example, we have the first cutoff is Z is 13, 12, 3, 1, and 5. And then those who individual below this first cutoff will be this, will be just this is all. They are deprived from the sum indicator. And then this is just give the explanation for those who don't really following this, how to calculate the MPI. And then we replace the indicator with the cutoff, and then from the MPI is the multiplication between the poverty head count and also the intensity of poverty. So this is just simple thing how to calculate the multidimensional poverty index in Indonesia. So using this kind of the indicator, we monitor about the progress of the multidimensional poverty index in Indonesia using the 4 indicator: health, education, standard of living, and employment, and using the several indicator. So looking at the condition, the last updated is 2016. We not updated the 2017, 2018, but we just updated from the 2019. So looking at the poverty head count, there is a significant decrease during the couple of years. So now it's becoming in the 2019 that the MPI head count index is 48%, and the intensity of poverty is 35%, and the MPI National Multidimensional Poverty Index in Indonesia is 17.5%. That is higher than the monetary poverty measurement. But in the 2019, there is significant difference, not very big, but little bit difference in the calculations because of the definition in data set itself. So this is also the challenge for calculating the national multidimensional poverty index when the data set on the questionnaire in the National Socioeconomic Survey is changing. But the main message on this is not about comparing between the before and before 2019 and the 2019, but we're trying to look at the little bit impact on the COVID-19 using the micro simulation. We're trying to use the micro simulation, how to combine the information from National Labor Force Survey and also information for National Health Insurance, make the simulation and the confirm that the COVID-19 has increased MPI headcount by 0.51 percentage point. This is equal to 1.35 million people, or increase MPI by 0.25 percentage point. This is we noted that this is only this is only use the three indicator from two dimension. Even though we're just using only the health and unemployment, and then there is significant increase for MPI in Indonesia. So this is a need to deeply explore by the government how to deal with these issues. So I think this is important. Yes, this is very important to monitor the poverty using the monetary one. But I think still looking at the multidimensional poverty is more important to look at the real human deprivation during the COVID-19. So if we looking at the potential risk of the COVID-19, I following the Al-Qaeda, the vulnerable group to the COVID-19, group at risk if the she or he is deprived in one of the indicator: drinking water, cooking fuel, or nutrition. So looking at the Indonesia, 45 or 46 million deprived from the modern cooking fuel, 160 million deprived from the access to the drinking water. So this is the condition that there is many people are vulnerable to be infected by the COVID-19. But lastly, I noticed the COVID-19 is health shock that disrupted all aspects of human life, and then control and the containment of the COVID-19 infection rate will be the most important policy for socioeconomic recovery in Indonesia. COVID-19 has made the shrinking of the economic group, Indonesian economy, effective 29 million workers, 4.5 million people no access to healthcare services, many of students no access to the education, long-term potential for learning losses, and also the dropout. Some adverse impact of the COVID-19 on welfare could not fully be represented by single measurement. So we need to be more comprehensive on the measure of the human deprivation during the COVID-19. So the MPI can be used for monitoring the progress of development in more comprehensive approach. So using the simulation, very simple simulation, and the COVID has deprived around 1.35 million people. This is just using the indicator of health and also employment. But if they combine all the indicator, maybe the impact is very huge. So I think this is for me to show that our update progress on the national multidimensional poverty index to consider about the COVID-19 in the calculation. Thank you very much.
Thank you very much, Dr. Dartanto, for your thorough overview of the current situation in Indonesia, which hopefully pinpoints areas where policy may be most effective. We now turn to Dr. Vivi Yulaswati, Senior Advisor to the Minister of Planning on Social Affairs and Poverty Reduction, Ministry of National Development Planning, Bappenas. Dr. Yulaswati, we welcome you.
Thank you, Nikki. It's been pleasure for to be in part in this session. Good afternoon for everyone in Jakarta time, and good day for everybody in other places. Let me start with my slides. I've been asked talking about the effect of COVID-19 on poverty and also policy responses. So I'd like to start about the COVID itself. When will the pandemic COVID end for Indonesia? In fact, by today, the cases still in very high hikes. This is per November 25th on daily cases is up until 5,000. If we see the previous peak projection of COVID, there is seems that we haven't yet at the top of the cases. If you remember in the beginning of the cases in March, we expect that the peak would be after Lebaran. Then finally it didn't happen, and then we expect that the spike would be on September. Again, it didn't happen. Now we are almost end of this year, and still we don't see yet the peak. So the uncertainty in the next future still visible. As Dr. Datanto already mentioned, that we are already in the recession and have impacted to the increasing of open unemployment, which happened in almost provinces, mainly in the provinces who engage in sectors like tourism and also high services. So you could see Jakarta, some provinces in Java, as well as in Bali, have quite high increase in the open unemployment. This is also related with the reduction of commuter workers in related big cities. So yes, the mobility very impacted to the economic activities as well as to the welfare. So we could see also that it impacted to the vulnerability, to the increase of the vulnerability and poverty. As you may know that the poverty in March 2020 already increased for about 1.63%. I mean, million people, new poor, in which if you see the number of the aspiring middle class, in fact, this is a bit increased from the previous data. So this is coming from the March 2020. And if we see the latter, who are the vulnerable, that's including the ones who have the income below around 6 million thousand. I mean 6 million rupiah. So that's including not only the poor but also the vulnerable and aspire middle class. So in the if economy okay, they are okay, but in any chance of shocks, including during the pandemic, they are partly hit most to become vulnerable. Mainly the vulnerability relate with the health as well as when they lost the job or income. So the poverty increased higher mainly in urban areas. If you see at the left hand side, the increase in urban area, I'm sorry, I lost the legend. The blue one is the city, the urban one. The red is rural. So if you see in Java, the poverty increased significantly in Java, particularly in the urban one. So if we compare to other data, the increase of the poverty within the growth as well as the Human Development Index, there is a positive associations in which show that, for example, HDI and the positive cumulative cases of COVID has a positive association in each province. So the region with a higher HDI, for example, are more vulnerable, I think, because relating to the mobility. Based on data that we have, For your information, I think you already aware that Indonesia database is quite rich. Besides the micro data of from Susenas, Sakernas, we also have Podes, and we could learn about the availability as well as the capacity of the supply side. This is only the example from the health facilities, number of the hospital, and also the health post, and until the bed capacity in each hospital. This is also only example about the granularity of the data that we have in make that make us available to analyze the housing condition of the poor and the vulnerable. Some of this data already mentioned by Dr. Dartanto. I'll skip it. And also we could see that when we want to applying policy, these data really help us to see the challenges. For example, about the ownership of the toilet facilities within each household, at the poor as well as the vulnerable. We could also see the problems of access to water in each provinces, in which some of them, in fact, not because the COVID, but in fact, that's part of our challenge that we're still facing. So based on those data, some indicative analysis that we had in the beginning of the COVID, the government modified the existing program by expanding the target, also enlarge the benefit, modify the distribution channel, and also the frequency, the time of delivery, and in stages, adding some more new programs for COVID-19 response. That's including support from the local government, like the food assistance, also the cash transfer, switching from the village fund, and also introduced a new card, which is for training for the ones who lost the job. So this is the map of the programs, and also where these programs go, including for each decile. So during pandemic, we actually targeted the social safety net program not only for the poor, but also to the vulnerable up until decile 6. In terms of the channeling, actually, we keep our plan to expand and to transform, to digitize the cash transfer. So during the pandemic, around close to 80% still transfer through the banks, while the remaining, particularly the new one, using the direct transfer by post office and into the community, directly to the community, particularly going through the Dana Desa, the village fund, as well as in remote places. So when we are talking about the corruptions and the leakages of the social assistance, mainly happen the risk in kind transfer. This is actually, if we talking about the size of the social transfer, it's account only 6.6%. This is also part of our insights that in the future, despite that during the crisis, it is better to keep the transfer using a digital way. This is following also other countries which have been transformed from the physical cash to use other the non-cash transfer and expand it to several stages. So based on the experience of this year to handle the COVID, as well as some simulation that show COVID will likely still happening next year. The government work plan 2021 will focus on some reforms, mainly on the national health system reform, social protection system reform, the disaster resilience management, as well as on the food resilience system. Of course, we still have to move other economic sector like industry and trade. And some outlook on for end of this year as well as 2021, we did some simulation, and based on this projection, we elaborate into budget to each program. So this is part of it, the continuation of social safety net in 2021, in which some of the new scheme still continue. For example, for the cash transfer, still have been planned and allocated for 6 months. This is, of course, based on the progress of the COVID response for the next year. So we within the reform, this is only example from the social protection reform. We actually develop a trajectory up until end of the 2025, which is end of the current midterm development plan, and will focus for the extreme poverty and the improvement to make the social protection more systemized. That's including to mitigate the impact of COVID-19, the early response, and then also improving some mechanism, the integrations of some social assistance, as well as the effort for accelerating toward the poverty reduction. One of the main feature is to develop a social registry. We are aware that outreach the people during the pandemic, during the crisis, and like pandemic, which happened in almost all across the country, need to be supported by a strong social registry. That's why we plan to link with the village information system. Mainly, we call it as a monograph, village monograph. So we're gonna digitize the village monograph and use it as an anchor at the village level. That's also including to update in a regular way. So the social registry, for sure, we include the poverty data, the ones that already exist in the UDB, Unified Database, or DTKS, and it will link also to the social security database, and we'll add the skills, entrepreneurs, and tax data. And DTKS or the UDB for sure will be part of the social registry. This is a timeline of the completion up until 2025, in which we expect that the local government will have a capacity to update the database, and also the interoperability between programs will be happening. At the end, we still see the 2030 agenda in our track. There have been some effort to analyze, to revise the targets, and in fact, we are aware that this pandemic unveiled many current systems are inadequate. That's why we use it as a momentum for reforms. For sure, we use the SDG principles and platform for collaboration, for work together, and for sure, using no one left behind, more inclusive, fair, and sustainable. By having collaborate with businesses and also academia, we want that everybody will have the same agenda for prosperity, which is balancing the social environment, economy, as well as good governance. And we are aware that during these days, it is necessary to build the scheme that are more adaptive. So in social protection, for example, we are going to develop the protocol for mitigation. Many reviews for sure based on research on how to build back better, and try to expand the database, the social registry, to outreach the missing middle, the small medium enterprises, and also expand or finding the disaster financing scheme, not only at the natural disaster, but also the non-natural, like the pandemic. So by having said that, I say that the future is now. We need to build our capacity using many research data, try to figure out how that the new way of doing things become part of the daily life, and having a vision toward the quality of life for every people. I will stress it out. That's why the database, we cannot only rely on the micro data, but also the micro one, using the social registry, and of course enhancing some other supporting activities, like improving the digital literacy and enhancing the social and human capital. This is a part of the agenda that we want to accelerate the achievement of the 2030 agenda. That's all that I can say. Thank you very much.
Thank you very much, Dr. Yola Selati, for your insightful overview of the steps the government has taken. We really hope that collaborative events such as this webinar may further support, assist, and help the government to address the needs of Indonesia's people. We now turn to our closing panelist, Dr. Basri. The screen is yours.
Thank you very much, Nikki. A very good afternoon or good morning. It is a great pleasure to be here. But before I start my remarks, my presentation, I have to confess I'm not an expert on the issue of poverty. My work's mostly related to the issue of the macroeconomics and international trade. But let me try to sort of like to provide an overview about the macro policy and impact on the poverty. So let me, hopefully you can see the slide here. Let me, oops. Just want to check, can you see my slides here?
Yes, we see them
Yes,
well.
Pak Dede.
Okay, thank you. So I called this presentation is K-shaped recovery. Yeah, this K-shaped term was coined by Peter Atwater from Williams and Mary College in the United States. And then I'll explain to all of you later on. But let me provide with some background about the economic recession. Yeah. Professor Kunchoro and also Dr. Dartanto already mentioned about that Indonesian experiencing a recession, nowadays. But if we make a comparison with other countries, actually Indonesia's economic performance was relatively well compared to others, because as IMF projected that our GDP growth for 2020 will be around minus 1.5%. And this is definitely better than country like Japan or even Singapore or even European countries or the US. And if you look at the average of ASEAN, is projected around minus 3.4%. So in terms of this growth, probably Indonesia is doing fairly well compared to others. But let me share with you some of my concerns here. Since the data is still not available, the official data, published data from the Central Bureau of Statistics, so I am using the transaction data from the commercial banks. Yeah, because in the commercial banks, we can see the transaction data about the incoming incoming transfer based on the profession. So based on that, we can use a proxy of the impact of the various income group based on the profession in the case of Indonesia. Yeah. Thanks for the Bank Mandiri to help me with this, the Office of Chief Economist. The way we look at this chart is 100 is the pre-COVID. So if go above 100, it means that go beyond normal. The interesting part is, if you look at the composition, based on the various income group, the one who get hit severely by this pandemic is the informal sector, because their incoming transfer or their income is a proxy of their income dropped by almost about 30%. What about people with the fixed salary or the employee? Not much affected because they get the fixed salary. What about the entrepreneur, the business people in the small, medium enterprise? Their income dropped by 15%. But if you look at the composition, this is the group of people that hurt severely by this pandemic. So that is why, from the beginning, I said that it is important for the government to compensate this group by providing the cash transfer. Yeah, I'll talk about it later on. Now, look at this pattern of the consumer spending. Again, this is data based on the transaction on the the EDC, etc. We classified into the high income group, the middle income group, and the low income group. It is very interesting. Until September, the proportion, the consumer spending, 100 is the normal. So the spending on this low income group was higher than middle and upper income group, except for the October. And I think this related to the long weekend. Yeah, because the high income group, they spent more during the long weekend on October. The reason why I could say this, if you look at the composition of the data provided by the World Bank in their report, the aspiring middle class, typical consumption of the low income group, they mostly focus on the their spending on food, probably around 30 to 40%, which is consistent with the Engels law. But if you look at the so-called the high income group, which is the spending more than 6 million per month, the middle and upper class, more than 6 million per month. Food is only a small part of their consumption. Yeah, the portion of food, the consumption on food is relatively a small part. They spend most of their spending on entertainment, on durable goods, housing, motor vehicles. And we can predict, during the pandemic, there is no entertainment activities. And durable goods, you only buy the durable goods only for cyclical. Yeah, and you don't buy a car every day. For that reason, that's explained why the consumption of the high income group dropped. Whereas the low income group, they need to maintain their consumption because they spend it on food. So what will be the implication? It means that the high income group, they cut their consumption. So where is the money come from? Where is the money go there? So this is data survey based on the Bank Indonesia data. The percentage of savings to total income. I think this is the very basic concept of the of Keynesian economics about the average propensity to consume. The idea is very simple. When your income rises, then your average propensity to consume drop, then you would expect that your savings will increase. Interestingly, this is the situation on August, September, and October. So the gray one is the October one. You can see for the group of people who spend 1 to 2 million per month, their savings drop. 2 to 3 million, savings drop. 3 to 4 million, more or less stable. 4 to 5 million, more or less stable, but tend to drop. But if you look at the group of people who spend more than 5 million, their savings increase because they cut their essential, non-essential consumption and they put it where they put the money. Look at this. This is the deposit growth based on a group of whether they put the money less than 100 million rupiah, between 100 million and 1 billion rupiah, 1 billion, and this one is more than 5 billion. We can see from this chart that the deposit, the third-party fund, that higher than 5 billion increased quite substantially. So this data is consistent with the group of people that savings increase. So all the story that I mentioned this somehow reflects that there are some group of people who are really affected, which is the lower middle income group, the informal one, and there are some group of people that probably could graduate from this crisis because they save money. They put the money maybe in the stock market, maybe in the bond market. If you look at the savings, then the savings for the one with the 5 billion rupiah increased quite substantially, 17.4% in terms of this growth, the year-on-year growth. So there is a race that probably the recovery, even though Indonesia is relatively doing very well compared to others, but there is a race of the so-called K-shaped recovery. Now let me try to look at the relationship against, because this data is limited. I'm using the big data from Google about mobility, residential, and comparing with the retail sales index, because again, the observation is limited. So the only thing that I can do is just using the correlation. But it is very interesting to look at the negative correlations between the retail sales index, consumer survey index, motor vehicle sales, basically all the economic indicators with the residential. When the consumer survey, the retail sales, when the economic situation is getting worse, then people should leave their house. Why? Because in Indonesia, unemployment is a luxury goods. Only the rich people could afford to be unemployed because we don't have unemployment insurance. If you are poor, you have to work. So what does it mean? The policy made by the government introducing the social distancing is biased in favor towards upper middle income group unless the government could provide the social protection or the cash transfer. And I have to say, this crisis is the crisis that we designed because the economy was doing relatively okay at that time, and because the pandemic, we asked people to stay at home. Who can afford to stay at home? The one who have the access or have savings, enough savings. But the poor people, they don't have savings. They cannot stay at home for the longer time. Then they have to work. So for that reason, that's explained why introducing the social distancing is very difficult for the country like Indonesia, like India, or the country with the relatively less established social security system. Because unless we can provide the cash transfer, we cannot ask people to stay at home because they have to work. Now, let me try to sum up this and then discuss what can be done. As I mentioned to you earlier, that the social distancing is biased in favor towards middle and upper income group if the government failed to provide a social protection. At the same time, there are some other sources of this inequality. Why is that? Some group, some sector that were able to survive this pandemic is the one who has an access for the digital infrastructure. And what is happening now is I call the accidental transformation, because shift to business models that leverage digital infrastructure, etc. So if your business model could adopt the digital technology, that probably you can survive. You can continue to sell your product by using the e-commerce. But the problem is with the digital infrastructure is not available in all over the country because the infrastructure problem. So there is a risk of the inequality. We can imagine that people in the eastern part of Indonesia, in Papua, the quality of the internet, of the Wi-Fi, much very poor compared to the one in Java or Jakarta. So there is a risk because of that. If people has to follow the online learning, education, but the digital infrastructure is not there, then there will be a problem. So there is a risk of the inequality. The other thing is because the companies are forced to implement the transformation, there is a risk of the disruption. I don't call it the job loss, but I call it this redefinition of job. So for example, nurse, they probably will continue to work as a nurse, but will require a different skill. Because they need to have the skill related to the technology. So recovery is taking place, but uneven. There is a problem of digital divide, the digital versus non-digital. So probably one of the solutions related to that is to do the collaboration. Now, what kind of policies that the regulators and the government can do? So I try to show my impulse response function. This is using the time series. The idea is very simple. Whether the government should focus on the production side or they should focus on the demand side. Production side means the government provide the incentive to induce investment. Once they induce investment, then company could hire worker and then they have enough money to spend money, etc. If the government induce the investment, this will be the response function of the private consumption, the red line. But if the government provide the cash transfer, not only for the poor people, to the lower middle income group, then you're going to create demand. Once the demand is there, you will induce the investment because the business people will see the demand is there. If we induce consumption, private consumption, by providing money, this will be the reaction function of the investment, the blue line. We can see from these charts that providing the cash transfer or money is more superior than inducing the production side. For that matters, I think the government should focus using the fiscal stimulus as a jumpstart, because I don't think the monetary policy will be effectively work. We can see in this kind of situation now, not only unique in Indonesia, all over the world, the interest rate is almost zero now. In Indonesia, it's probably in the lowest in our history. But we don't see much improvement on the investment because the logic is very simple. What's the point for the company to increase their investment if the demand is not there? So we are basically back to the basic principle of the Keynesian model that we need to induce the demand first. So that is why the role of the fiscal policy is very important. Now I'll explain to you what kind of fiscal policy that we need. So this is my op-ed with Rima Hanna and Ben Olken. When we use the fiscal policy, it should be designed to address the issue of the risk of the K-shaped recovery. We highlighted in our op-ed that many of the government's typical social protection programs, such as the conditional cash transfer and the staple foods, are geared toward the poor. The targeting in this program is based on the household asset. That makes sense for the anti-poverty program. This asset reflects the long-term poverty well. But these programs miss workers who have recently been hit by major shock, such as lost wages or lost income from business. In fact, many lower middle class workers were gainfully employed just a month ago, but now they have no income. So many do not have enough savings to get by if they lost their income. That's exactly why I presented in my first slide regarding the impact to the the informal. So what can be done? Our recommendation is perhaps it is very important for the government to extend this cash transfer program or the conditional cash transfer, not only to the poor people, but to the lower middle income group. Yeah, the issue is about data. So our suggestion is, the government now have the so-called the new pre-employment card. I do understand that this program has been criticized strongly because it's provide the online training which is probably useless. Sorry to use this strong word, but that's the criticisms of the people. But in our view, this program still have a merit behind it. Why is that? Let me try to give a sort of like a very simple illustration. Yeah. If people think that this online training is useless, so logically, once they sign in to this online training, they're gonna drop out because they don't see the benefit of joining this online training. But if those people stay, it means that their objective is not the online training because they are looking for money. So we can identify people who shows that refill of preference. If they are badly need the money, they will stay even though the program is useless. So this pre-employment card can be used as the good start to identify who are the poor. And that's exactly what we did in 2013 to 2005, where we introduced the cash transfer. People has to queue for many hours to get about $15 or maybe $8 at a time. I don't think the middle and upper class would like to spend 5 hours only to get $8 to $12, right? So if people stay queuing to get the $12, they must come from the poor or the near poor. So rather than targeting the poor, it is better to ask the poor to show themselves. So this is one way to do it. The second option is perhaps to work with the Home Ministry, the telco firms and banks to identify the lower middle incomes. How are we going to do it? Because we can use the SIM card, because the telephone company could do the profiling who are the lower middle income group based on the spending on the SIM card. Mostly probably, their spending on SIM card will be relatively limited compared to the rich one. And the Home Ministry do have the data of the NIC, the ID number. So we could do, maybe it's not 100% perfect, yeah, but we can identify the lower middle income group. And then the way we support the middle and lower income group, we can even use the SIM card. We top up and then we let them to cash out, maybe in the Indomaret, etc. The third option is to use the community-based targeting. Yeah, because they are the one who have the data. So based on that, yeah, I think it's very important for the government starting from now, because there is a risk that in the future there will be a K-shaped recovery, to design the fiscal policy focused on the issue of the social protection, digital infrastructure, investment on education and training, because there is a risk of the disruption, and of course, the access to health. So I think I leave it up here, Nikki. So thank you very much.
Thank you very much, Dr. Basri. Now we come to the Q&A session. Unfortunately, we don't have a lot of time, so I'm going to limit it to one question per panelist, and hopefully each panelist could spend around 1 to 2 minutes each. I'm hoping that all panelists could switch on their videos during the Q&A session. So now we first turn to Professor Alkaya. This question is about the gradients of poverty. Can multidimensional poverty measurement also pinpoint those who are vulnerable and in severe poverty? And how does this approach link to inequality measurement? So Professor Alkaya, the screen is yours.
Thank you so much. That's a very good question. And yes, we regularly implement multiple poverty cutoffs. In the global MPI, we implement 3, severe poverty, poverty, and vulnerability. And that is also the case in many national poverty measures, where they have different definitions and different cutoffs for different grades of poverty. And that enables you, in a sense, to create a cross-section. And our colleague Luis Felipe, for example, did that in Brazil. Colleagues in ESCWA have done it in the Arab states, of the poor, the lower middle class, the upper middle class. So in a sense, look at the distribution, as some colleagues did in other studies, in a multidimensional way. And in terms of inequality, the most direct analyses of inequality are the ones that I showed you with different cutoffs. You can see who's poorest and how they are progressing, and what indicators they are deprived and how those have changed. We also, with James Foster, have a paper which axiomatically proves an impossibility theorem. It's impossible to have any multidimensional measure that can be broken down by indicator, which is very important for policy, and itself reflects inequality among the poor. However, we do a class of measures in which the first element is the headcount ratio, the second element is the MPI, and the third element is a measure that includes an inequality transformation. And we analyze the variance in all of the global MPI reports, so you can see the variance among the poor, if you're interested in that. But for policy purposes, the most interesting inequality information is really read off of the measure in terms of the composition and the level of poverty and deprivation scores that people experience.
Okay, thank you so much, Professor Alkaya, for your very insightful answer. We now turn to Dr. Basri. So as a follow-on to the issue of poverty and inequality, from Professor Alkaya, we learned that the MPI allows us to look at both poverty and inequality. So for Indonesia, which is more pressing currently? Is it the issue of poverty or inequality, or is it both?
My answer will be both, but looking at this current situation now, in terms of poverty, we are doing relatively well compared to others. I think the issue of this inequality is a very pressing at this moment. If I may have to sort of like to put the priorities, I think the issue of inequality is become very crucial, because in terms of the poverty, we made a lot of progress. Yeah, even though the pandemic definitely will have an impact on this poverty incidence.
Thank you very much, Dr. Basri. We now turn to Pak Teguh and Ibu Vivi. So gender issues are very important, and gender inequalities are also really important in Indonesia. So firstly, maybe for Pak Teguh, if we were to create a national measure, a national MPI measure for Indonesia, given the current data that we have, would we be able to include gender inequalities within the measure? Over to you, Pak Teguh.
Okay, okay, thanks. Thank you very much for the question about the gender issue. I think, as I mentioned, Prof. Alker also, I think the problem is the data constraint itself, because it's not only issues of the gender. I think so many issues also on the environment issue, like the sustainability, for example. This is many, there's also a question about this. So I think it's from the Susanas is also is very, yeah, there is a possibility like the comparisons between, for example, in the education, for example, between the gender, for example. But if you're using the education in Indonesia, the female has the higher education, to say, years of schooling compared to the men. So maybe if you just using the, for example, from the Susanas and also years of schooling, or comparing between the female and male, maybe the result is also biased. So we need to the data to represent about the gender issues in MPI, and also trying to find the appropriate data set. But under the Susanas data set is quite difficult to capture the gender issues in MPI. But this is still possibility to adopt that issues.
Thank you, Pak Teguh. Now over to Ibu Vivi, also on gender inequalities, but more related to policy. So how do you think COVID has impacted gender inequalities in Indonesia, and how is the government addressing this issue? Over to you, Ibu Vivi.
There have been studies about the issue that you've asked. Some of the results show that the women have more burden, particularly due to the the burden from the school homeschooling, as well as how to manage their daily life, yeah, because the income have been reduced. I'd like to add one more point about the gender in terms of the data. Within the SDGs, we have several targets in relate to gender, and some of them are quite detailed. Yeah, so not only eliminate about the harmful practice, but also recognizes the some values and ensuring the women rights. Some of them are in a discussion not only in Indonesia but also global. So I do hope that with the better quality of the data in terms of the gender, we could develop also the data, yeah, not only at the national but also at the local level, and slowly but sure we could find out the solution on improving the the women rights.
Thank you very much, Bu Fifi. There's another question for Professor Arkaya. Could we still integrate monetary poverty measures within multidimensional measurement if indeed monetary aspects are still considered as important within the national context? Over to you, Professor Arkaya.
Yes, technically it is possible if, for example, the data source is something like Susanas that has variables of a multidimensional and monetary poverty measure. A couple countries have included it, but with a very light weight, maybe 1/12 of the measure. But the more common practice, for example, in Chile or in Bhutan or in others, is to cross. And so to have your multidimensional poverty measure as an official statistic and the monetary, and then where they come from the same survey to say what percentage of people are deprived in one, deprived in the other, or deprived in both. And that proves to be quite revealing. When Chile launched its MPI, 20.4% of people were MPI poor and 14.4 were monetary poor, but only 5.5 were poor by both measures. The advantage of having two is that one is already familiar, and then there is sort of an agreement about using a second measure to supplement it. When they are combined, then there are discussions about the weights, which can make the measures a little bit less convenient. Also, an MPI can be easily updated with remote or rapid surveys because the questionnaires are much, much shorter, whereas a consumption questionnaire is very long. And so for interim updates, many countries find it more convenient to update the MPI.
Thank you very much, Professor Alkaya. So over to Pak Dede. One last question. Pak Dede, how do you make sure that cash transfers are used to buy goods rather than to increase savings? Over to you, Pak Dede.
Well, I think there's study has been study done by Ben Olken and Rema related to this. Yeah, on the case of Indonesia, it shows that this cash transfer is actually effective in the sense that even the way they spend the money was spent effectively, not even on the maybe small amount portion on the tobacco, SIM card, etc. And this is not unique in Indonesia. The similar case, if I'm not mistaken, also in the case of Mexico. So probably people can refer of Ben Olken, Rimahana, and others study related to the cash transfer.
Thank you very much, Dr. Basri. We now unfortunately come to the end of our webinar. We thank our eminent speakers for the vibrant and insightful discussion they have given us. We thank all those involved in organizing this webinar at OPHI and also at FEBUI. We also thank our audience who have joined us today from all around the world. Thank you so much for your important questions and kind attention. We hope that this webinar is the start of many collaborative events and research projects to come, which we dedicate to supporting Indonesia overcome the effects of the pandemic. Please look out for more webinar links. We welcome you all to future events we may hold. Thank you so much, everyone. Stay well and safe.
Thank
Thank you.
Thank you.
you very much.